Hope Channel, changing lives.
Who is a psychiatrist at the Komfano Teaching Hospital. He'll be joining us on Zoom, and when he joins, we'll all see him. They both have immense knowledge and experience on mental health issues, and they'll be sharing it with us today on Consulting Room. So please stay tuned. We'll go for a quick commercial break, and when we get back, we'll get into the discussions.
Every individual has a story. Stories of social issues such as infertility.
You did not marry your wife only because she's going to give you a child. You married because you loved her. Whatever comes on your plate, you're ready to accept that.
Abuse, obesity, life struggles, and others can be very frustrating. That is why Real Talk is back again with another exciting season where individuals like you can come into our studio or join us virtually to share your story and experience. To share your story, you can reach us through our WhatsApp number at 0559 680 066, or you can email us at hoptvghana@gmail.com. We say don't lock them away. If you ignore them, they can just get angrier and louder.
Welcome back from the commercial break. We would like to hear from you, so please do well to send in your questions and comments to the various social media platforms, and we'll be more than happy to give you an answer. So we'll get right into the conversation now, and I'll start with Dr. Cranton. So we hear a lot about mental health. Why is it such a big deal?
Okay, so mental health is life, and I would explain why. Every day, people are faced with stress, and to deal with stress, there's a certain mental capacity needed to deal with any form of stress. Right from the word go, when you wake up, it begins, you are thinking, you are planning into your day. So a a healthy body without a sane mind is definitely unhealthy. There's nothing you can fulfill in a day if you cannot concentrate, if you, even if you have a bad night's sleep, you realize that your day looks some way. So mental health really, really matters. Everything revolves around mental health. If that flies out of the window, your functions, everything about you is gone.
Okay. So what are some conditions we can consider under mental health? Okay,
so there's depression, there's mania. Mania is when somebody looks hyper aggressive, talking a lot. The person has this excessive energy. The person is either hyper religious, or all of that form comes under mania.
Okay.
And there's the common one many people know, bipolar. So the person is swinging between the manic pole and the depressive pole. So there's unipolar depression, there's unipolar mania, and then the person is swinging between the two, and that's why we call it bipolar disorder.
Okay.
There's schizophrenia, there's schizoaffective disorder, there are substance and substance-related disorders, there's mental retardation, now known as intellectual disabilities. There are psychosexual disorders.
Okay.
There is sleep and sleep-related disorders. It's a broad area.
Yeah, I can see that. Mental health is such a big topic. So you mentioned a lot of things, but are there some things that we do that predispose us to getting any of these conditions?
Okay. So I've had parents or relatives of patients ask me a simple question: Doctor, where is this from? And it's quite a very difficult moment, especially as they seem to be struggling with coming to terms with what is happening to their relative. There are a lot of things that can predispose anybody to. A family history. If there's been anybody in your family who has been diagnosed, there's the likelihood that it is something that is genetic.
Okay.
Anybody who is abusing drugs or any substance predisposes him or herself to getting any mental illness.
Okay.
Normal day-to-day relationships. I keep telling people a simple text message breaking or calling off a relationship can trigger somebody into depression. So there's not a clear-cut risk factor. The fact that, so there are people who have gone to work, had a very bad day, or on their way to work, they had probably an accident or a fall. And then it tips them off into what we call PTSD, post-traumatic stress disorder. Or somebody has a very bad dream. I've had somebody whose trigger was a dream.
Okay.
So anything and everything right now, by my experience, can tip anybody off into mental illness.
Okay, so with the things you've mentioned, how do we diagnose it? Is there a list that you're supposed to check to say, okay, you check all these things, so you have this condition or this condition?
Okay, so I think knowledge is key. There are things only a trained eye can see. So we've had people, okay, let me use an example. So there was this case I saw of a man, and I diagnosed, but then I was explaining to the relatives how the symptoms of the disease manifest and all that. And then the daughter of the man was like, then daddy had been sick for a very long time. She was at that time, I think 27. And she says for as far back as 25 years now, she can say, judging by what I've just told them, that daddy was unwell. So you can't really, because there are days, it's a subclinical. It is not something you can say you are taking the person to the hospital for. So somebody can be very hyper, very active, has energy all the time, moving around. That person could probably be hypomanic in a possible bipolar disorder. But then he's functional. Most of our best-selling authors are bipolar. When the mania or when they are manic, that is where they get the energy, the creativity, and all that. So they don't like taking their medication when they think they are creative.
Okay.
So they get that energy, pour it all out into a book, and they take it on the journey in their minds with them. So so that's why you find it difficult to put some of the book down. Yeah, all of that action is a manic mind.
Okay.
Some people are excellent at their jobs because of the disease.
Okay, so it's not all bad.
But the thing is, if it goes to the extreme, then now the excessive talking, the misbehavior begins. So it takes a trained eye. At times when people, and psychiatry gives you a certain lens to look at people and extend them a hand of grace. You know that, oh, all is not well. If somebody could, So it's not like you are checking boxes, but when the person, by their speech, that's what we call the mental state exam. So by that criteria, you are able to put somebody into a certain disorder.
Okay. So here Dr. Apreku has joined us. Hello, Dr. Apreku. Hello, Dr. Apreku. Can you hear us?
Yes, I can. Can you hear me?
Yes, we can hear you. You're welcome. Thank you for joining us.
Thank you. Thank you very much for having me.
Okay. So we'll just continue with our questioning. So I'll just come to you then. What makes someone, what is the criteria for admission to the mental health facility for someone?
Okay, thank you. A very good evening to your viewers.
Yeah.
I think that this is a very important topic, and kudos to Hope TV Ghana for setting this up. Mental health is something that is very important that we all must take very serious. You know, we don't function without our brains, and so our brains are one of the most important, if not one of the most important organs that we should take care of. Now, with regards to admitting someone to a mental health facility, usually the litmus test or the basic thing is that if the person poses a threat to themselves or to others or to property. So, for instance, someone who is suicidal, for instance, that person is a threat to themselves. Or sometimes you have someone who is hearing voices and the voices are commanding them to harm themselves. In that case, the person is a threat to themselves. Sometimes people can be a threat to others. So Dr. Cranton was just talking about people who become manic. Sometimes in a manic state, a person may have false beliefs. So they may believe that, for instance, they are the president or they are a very important person. And sometimes out of that belief, the usual Ghanaian belief is that when you become wealthy or when you get into a good place, a fearful are going to try to bring you down, right? And so in that state where they have a belief that they are a very big person, they are an important person, they may come up with the belief that if I'm an important person, then certainly there are people who want to bring me down. And so they may target some people with the belief that these people want to harm me. In that case, this person is a threat to others. And then sometimes they become a threat, they just go about destroying things. And so you don't want them to do that. There are some other indications, like sometimes you are not sure about someone's diagnosis. Sometimes you may need to admit someone just to observe them. Okay. For instance, there is a condition where a patient may come to you and say they are unable to sleep.
Okay.
And then let's say usually they are more females. It happens more to females. So let me use she. So you ask her husband, and her husband says, well, I think she sleeps fine. But this person insists that I am not sleeping. And so what you do is that you admit them and then observe how they sleep. And so sometimes you may need to admit people just to observe some behavior or some complaint that they have. Sometimes too, it might just be for what they call it, investigations, or you want to start some treatment and you want to see how they are going to do on the treatment. But basically, the most basic reason why people are admitted would be if we deem them to be a threat to themselves or to others, then you need to admit them.
Okay. So I think we need to rule out that misconception amongst the public where when someone says they are at the psychiatric hospital, we say they are mad, right? It's not necessarily true, and there are so many other reasons why people are at the psychiatric hospital, right? So I'll come to Dr. Cranting. Sure.
Yes. So, yes, certainly. When you hear that someone is at the psychiatric ward, it doesn't necessarily mean they are mad. Now, in the diagnostic manual for the American Psychiatric Association, there are about 300 identified mental illnesses.
Okay.
These include sleep disorders, sexual disorders, eating disorders, personality disorders, anxiety disorders. All of these are things that happen to people, and their behaviors are not bizarre or abnormal, right? And so that someone comes to psychiatry or goes to see a psychologist does not necessarily mean that they are mad, if we are going to use that word.
Yeah, sure. Thank you so much. So, Dr. Cranton, in the more developed world, like we have people being admitted in rehab facilities for, say, substance abuse or abuse of drugs. We have those facilities in Ghana.
Oh, yes, we do. We do. Pantine runs a rehab facility. Anchor Psychiatric runs a rehab. I think Accra Psychiatric also runs a rehab program. There may be a few private owned. I know the Brain and Mind Clinic runs a 12-step program. There are quite a number of other private owned and then church or para church owned facilities. So yes, there are a lot of them. And then I think when you look for help, you definitely be led to one.
But how different are they from the mental health facilities?
Okay, so Pantine is a mental health facility, Accra Psychiatric is a mental health facility, and a rehab center is in a mental health facility. Or rehab centers can be set up separately. So somebody who has depression may not necessarily need to go to a rehab facility. Might have to come to a mental health facility.
Okay. So, Dr. Preku, you mentioned psychiatrists, psychologists. What's the difference? Are they the same thing? Are they different people?
Okay, thank you. So, psychiatrists and psychologists work in the same space in mental health. In Ghana, to become a psychiatrist, you first need to be a doctor, as in a medical doctor, who then specializes in psychiatry. So psychiatry is exclusive to doctors. However, with psychology, in Ghana, you need a minimum of a master's, a graduate level degree to be called a psychologist. There are some jurisdictions where you need to have a PhD before you become a psychologist. And then in Ghana, psychiatrists are regulated under the Medical and Dental Council, but the psychologists have a psychology. There's a council for psychologists, and that is the council that regulates and licenses them for their practice. But in terms of what they do, there is some overlap. So basically, because psychiatrists are doctors, they are allowed to prescribe medications, for instance. But psychologists, depending on their field, usually deal with talk therapy. And then in terms of specializations, psychology has a very wide range of specializations. For instance, someone can go into just behavioral psychology or industrial psychology, or for instance, those who advertising agencies use psychologists for their work. They can also go into forensics. But in psychiatry, the number of subspecialties are limited as compared to psychology.
Okay.
Yeah.
Okay. Okay. Right. Thank you so much. So, Dr. Cranton mentioned depression previously, and it's one of the main things we hear about when we're talking about mental health. So if you can just tell us a little about depression. What is depression, and is there a particular group it affects?
Okay, thank you. So depression is it's an emotional state where somebody feels overwhelmingly sad for at least a period of 2 weeks.
Okay.
So it may begin with a feeling of sadness or crying bout, and they cannot tell why they are crying. They feel hopeless, helpless, or worthless. It's usually accompanied by poor concentration, the feeling of or the loss of pleasure in things they used to enjoy doing. So they are often in bed all the time. They don't want to go out, there's social withdrawal. There may be suicidal ideation, so the person feels like they have to end it all, or they wish they were dead. Some also actually go on to actually attempt or commit suicide.
Okay.
It may also be complicated by hallucination, that is either hearing voices or seeing unseen beings. So that's depression.
Okay, but does it cut across all age
so
groups?
yes, it affects everybody, men and women, but then the predisposition is towards female.
Okay.
So a larger number, if you do the comparative analysis, it occurs more in females than in male.
But what about age groups?
Age groups is more teenage to middle-aged women, men and women.
Okay.
More often. But then it can also happen in older persons. So there may be somebody who may be coming in with something that looks like dementia, but then there's one condition called pseudo-depressive dementia. Once you treat the depression, the dementia-like symptoms go away. So it can happen in older people. There have been quite a number who come in, and then when you begin to ask questions concerning depression, like the symptoms, they give you that vibe, and then you know this is something of that sort.
So let me just divert a little from depression. Because you mentioned dementia. Does dementia fall under a mental health condition?
Oh yes, please, it does.
Okay. Okay, so we'll get into that shortly. But Dr. Afreku, are there any triggers for depression? Hello, Dr.
Yes,
Afreku.
basically, yes. So what happens is that usually it's a combination of factors. Sometimes there are no discernible triggers, but mostly you'll find that there are some life circumstances that happen and then they tip people into depression.
Okay.
I think the most common that we can talk about is heartbreaks, but then things like losing your job, losing a loved one, sometimes a change of environment. So for instance, a child goes from home where they've been sheltered, where they know everybody, they are very comfortable, they know what the rules are, to school where they don't know anyone, they don't know what the rules are, there are no familiar faces around. That's change. The stress from that can also tip someone into a depression. Sometimes some substances, especially alcohol, people who drink a lot of alcohol are prone to depression.
Okay.
Unlike what people hear that drinking a glass a day actually helps you, that has been debunked and it's not true.
Okay.
And also sometimes it's just the person's makeup. So there are some people who are prone to having negative emotions, right?
Okay.
We say they are neurotic. You usually find these people, like when something happens, they don't take it like everyone else takes it. They take it more personal. They take a more negative view of events. And such people are more prone to having a depression than others.
Okay.
Yeah, so these are some of the things that can tip people into depression.
Okay. But if I am, say, depressed, would I know I'm depressed, or I'll need to be seen by a specialist to know?
For a lot of people, they will actually recognize the fact that they are not happy.
Okay.
You see, we don't really have a word for depression in our Ghanaian languages. So the best that they will notice is that for people who are educated, they may actually notice that they are depressed. But for a lot of folks, they may not be able to say that it's a depression. They may recognize the fact that they have become very sad, or they are not feeling happy. They have been crying a lot. They have been feeling like ending their lives and all of that.
Okay.
But so there are some people who would know, and there are some people who might not recognize it. But even those who do not recognize it, when you talk to them about their symptoms and then tell them what you think is the problem, usually they are likely to agree that is the problem. Yes.
Okay. Do you have anything to add, Dr. Cranton?
Oh, I think Dr. Preku has mentioned most of the things with regard to depression. And like I said in the beginning, anything at all, like you mentioned, any life event can tip anybody into depression. So
that said, is there a cure for it?
That word cure in psychiatry is used with a lot of care because people relapse.
Okay.
So it's not like malaria or diarrhea where you take this and the condition goes away. So that's why we keep seeing some people. The person can go into remission, and then we know that. So it becomes there we are treating, and then the person becomes stable and then goes into remission, because we know that we can't control life events around us. So there's a likelihood that another event can tip the person again and bring the person back to us. So we use it with a lot of care. We rarely say you are cured. We say, you have improved, and then or you are better. So you can go and then you navigate your way through. Some may never come back to us.
Okay.
But then again, because it is life, we don't say you are cured. There are medications available. So there are antidepressants available. So for somebody who is depressed, may need, just depending on if it's mild, moderate, or severe. So a mildly depressed person can just see a clinical psychologist for talk therapy.
Okay.
So they know what they do. So they talk, and then they are given coping. Maybe just the way they are coping with the situation isn't right. So they are taught what to do.
Okay.
If it's severe or moderate, depending on the intensity, we add medication to it.
Okay. So I'll come to Dr. Preku. You mentioned people who are suicidal. So someone has come to you who is suicidal. How do you deal with that person?
Right. So as we approach any patient who comes to the hospital, first you need to get a detailed history and then fully examine them. Sometimes depression can be as a result of a medical condition.
Okay.
An example is hypothyroidism, right? And then suicidal ideas also may come from other psychiatric conditions. For instance, someone could have schizophrenia and be hearing a voice asking them to kill themselves, so they attempt suicide. And then sometimes it's not actually because they are depressed, but it's because of some life events. So, for instance, these days people bet a lot, and so people lose a lot of money and property in betting. And I have seen a few cases where someone lost a huge amount of money in betting, and so they decide that they can't cope with the disgrace that comes from people knowing that they squandered that amount of money, and so they attempt suicide. And so you need to evaluate them fully, and then when they are evaluated, depending on the level of risk that you find. So there are tools that we use for measuring the risk of the person actually completing suicide.
Okay.
Right? Things like if they have a plan, for instance, or if they have already thought of how they are going to commit the suicide or complete the suicide. If they have already written their will, there are some people who write a suicide note way before the time that they actually do the suicide. So you assess all of these things, and when the risk is moderate or high, they need to be admitted.
Okay.
And then when they are admitted, usually the help that is given them include medications. Sometimes because of the risk of suicide, they need to be sedated.
Okay.
So that they are not in that distress anymore. So it might include medications, and then also you give some psychological support. So in a case where you have a clinical psychologist, the psychologist will start having sessions with that person. And then also you need to engage their family and the people around them, their spouses, their children, their friends, that they also provide support to the person. Sometimes there are some things that are in the house, that are at workplaces, that are tipping these people into that condition. And so you need to help them sort all of those things out before they go back to that environment.
Okay. Okay.
Yeah, so that is basically, that's the way that you go for someone who has a risk of suicide.
Okay. So I'm worried about my mental health. I just feel like something is not right mentally, or maybe I'm worried about a friend or some other person. Do I walk into a general hospital, or can I just walk straight into a psychiatric facility? Dr. Apreku.
So the way that it works is the way that it works for every other condition.
Okay.
Right? Now, in the mental hospitals, there you do not need a referral to go there.
Okay.
You can just walk in. But in a place like Korle Bu, you would need a referral to go, because it's a specialist field. You need a referral from a general practitioner to go see them.
Okay.
Usually you do not get the opportunity to just walk in, except in the at the private facilities where things are a little bit more liberal, and so you can just go and request to see a psychologist or a psychiatrist or any mental health expert who is available.
Yeah. Okay. All right. Sure. Thank you so much.
Okay, I would want to add that for Korle Bu, they've done well to remove that loophole of a referral because it's mental health.
Okay.
So for Korle Bu, you can actually walk into the psychiatry department.
Okay.
So you can go there, and then they would process whatever it needs to be processed for you. So yeah.
Okay. Okay. Sure. That's good. Okay. So this conversation is getting very interesting, but we'll just stop and then go for a quick commercial break, and then when we get back, we'll continue with the discussion. Please stay tuned.
Every individual has a story. Stories of social issues such as infertility.
You did not marry your wife only because she's going to give you a child. You married because you loved her. Whatever comes on your plate, you're ready to accept that.
Abuse, obesity, life struggles, and others can be very frustrating. That is why Real Talk is back again with another exciting season where individuals like you can come into our studio or join us virtually to share your story and experience. To share your story, you can reach us through our WhatsApp number at 0559 680 066, or you can email us at hoptvghana@gmail.com. We say don't lock them away. If you ignore them, they can just get angrier and louder.
My understanding about laws is that they are rules and regulations governing our society, yes, or our community.
They are like rules. They are made to regulate human behavior.
Right to freedom, right to life, right to own property. Yeah, that's what I know.
Yes. The Supreme Court. Okay, so Shaj, don't see what you. Yes, my right has been violated. In school, I heard that corporal punishment is now abolished, but my teacher still used to cane us. The highest law in Ghana is the Constitution.
This is difficult. The law on life. I think the law on life.
So which is which? The Constitution or the right to life? Why don't you join me, Anita Delight Dankwa, every Thursday at 6:30 p.m. as we discuss all legal issues from a Christian perspective on Hope Channel, your preferred Christian channel.
Welcome back from the commercial break. I hope you're enjoying the conversation and you're learning a lot as well. So we'll get into another part of mental health conditions. And there's something we mentioned earlier, post-traumatic stress disorder, PTSD for short. Dr. Cranton, do you mind telling us what that's about?
Okay, so like the name implies, somebody has suffered some traumatic event, and by virtue of that event, the person has this anxiety surrounding the event. So, for example, armed robbers came to your home, attacked you, robbed you. Now, if you are home, you start feeling anxious. You start looking around, trying to see if there's anybody around. At times you even hear or you think you heard footsteps behind the window. You start getting palpitations. Anybody touches you, you are startled. That's a classic case of post-traumatic stress disorder. You are getting anxious because of a certain event that was traumatic to you. That is in brief.
Okay.
So most army veterans come back home from war, and they have this tendency. Some cannot sleep because every time they close their eyes, they keep seeing flashes and images of whatever it was at the battlefront. Some, in some severe cases, have actually attacked their spouses because they felt that the spouse was just touching them, but they went quick into military mode and then attacked. Now they realize, no, they are home and they've hurt somebody else. And that's why most army veterans are either on the street or they are suffering. So they feel they are safer, the family is safe without them. Those are classic cases of PTSD. So people who have suffered a certain traumatic event tend to have post-traumatic concerning the event or whatever it is that happened to them. Yeah.
So what form of help or support is available for them?
Okay, so for them, some may need medications and a lot of psychotherapy. So they have to see a clinical psychologist. Yeah. There's what they call focused trauma cognitive behavioral therapy for people who have suffered trauma. Yeah.
When you say psychotherapy, what exactly is psychotherapy?
That is the psychologist want to redo, what do they call it? Psychopharmacological treatment, and then they do the psychotherapy.
Okay. Dr. Apreku, I don't know if you have anything to add to that. But if not, if you could just talk to us about personality disorders. I think that's another part of mental health that's very important.
Yes, so personality disorder. So when we talk about personality, we are talking about the traits that a person possesses. And usually we say they are enduring across time and conditions. So there are people who, for instance, we know that they are very cheerful, and it doesn't matter the place, the time, since like maybe you last met them 10 years ago, but you meet them today and they still have that cheerful disposition. So that is their personality, right? And these days, it's usually measured according to the 5-factor model. So we have traits, there are 5 traits that you rank people on, and it's always a scale. So we rank people according to openness, conscientiousness, extraversion, agreeableness, and then neuroticism. If there's time, we can go into them one by one. But yes, this is what has replaced the old system where people talk about phlegmatic, choleric, those things, melancholic, the ones that were proposed by Plato or Aristotle. But when we talk about personality disorder, we are talking about where a person has a trait that makes it difficult for them to deal with other people or for other people to be around them. For instance, when you have someone who just doesn't respect authority, that's when you make laws, when you make rules, it doesn't matter where, whether in the house, at school, at church, once they know that this is a rule, then it means that this is what they must break. So they steal, they quarrel, they can't sit in one place. If we all agree that we stand at this time, no, they must stand. They want to go out of class, so they are true ones. In the end, usually these people will end up either in prison, at the hospital, or at the morgue, or at the psychiatric institution, because that is where that part goes. But when a person has a trait that is such that it makes it difficult for people to deal with them, like someone who has what we call a borderline personality disorder. Borderline means that this person craves attention, and they have a very unstable view of themselves. So for instance, when they meet someone and the person starts giving them attention, they give everything to the person. So usually you find that these people, today they are in a relationship, tomorrow they are no more in that relationship, and then they go to the next one. So within a very short time, they are in many relationships because they crave that attention that you get in the beginning of a relationship. Once there is the hint of that attention going down, then they have to move on to the next thing. They are very dramatic and will do anything to get attention, including even harming themselves. And so you see that this is a very problematic trait. Yes, and so when we talk about personality disorders, we are talking about when people have some traits that make it difficult. There are some people that they like their things to be in a certain way. If you don't do it that way, it's like when you go to their kitchen, the glasses are arranged in an order. And if you do not arrange them in that order, like you are dead. It's not that you broke one or you didn't wash it well or something, no, but it's in a certain order. If you don't do that order, then there's trouble. And so it makes it difficult for people to deal with them. Yes, and basically that's the distinction. The fact that it is such that no one wants to be around them, and then it becomes a problem.
So what can be done about it?
Well, unfortunately, per the definition, we say that it's enduring. And so mostly, if you are lucky, you are able to channel the trait into some relevant profession, for instance. So for instance, those who are very aggressive and do not like authority, and they are very combative, if you are able to put them in a sport like, say, boxing, they do well in a place like that, because they always want to show people that they are strong. Or for people who have what is called histrionic personality disorder, where they are just, let me say, drama queens. So they exaggerate everything. They can cry on demand. So you put them in, say, acting. Yes, if you are lucky, these are some of the things that you do to help them. But by definition, there isn't much that you can do for someone who has a personality disorder. And so actually there's a debate on whether it should be classified as a mental illness at all, because there isn't much you can do about it. And when it comes to the legal aspects of a personality disorder, like, you know, there are some instances where a mental illness is an excuse to not punish someone for a crime.
Yeah.
But if you say personality disorder, well, if you commit a crime because of your personality disorder, you are still going to be held accountable by the law.
Okay. Okay.
Yes, and then since there's not really much that is done for them, it's like, why do you then classify it as a disorder? Yeah.
So I was actually coming to that question. If someone with a mental health disorder commits a crime, are they held accountable for what they've done? So maybe you can just shed a little light on that.
Well, by law, everyone who commits a crime must be held accountable for it. Now, what happens is that there are some instances where the person who committed a crime, A, didn't have the mind that this was a crime, or B, didn't have the intention of committing that crime.
Okay.
And when those two come together, sometimes the court is able to grant that, okay, it's not that they are not guilty, right? They are still guilty of committing the crime, but because of the state that they were in, for instance, so the court is going to pardon them. But usually that comes with conditions, such as there are some people that because of that, then the court will decide that they should be put in those days where you had asylums. They should be put in an asylum for the rest of their lives. So instead of going to prison, they are committed to a psychiatric hospital or an asylum. But sometimes the court will say that, okay, we are pardoning you, but it is on the condition that you have to be taking your medications every day. And if we get any complaints that you are not taking the treatment being offered, then the court will punish you, right? But usually that decision is by a court.
Okay. So thank you for clearing that. It's not just a matter of you just saying, oh, I have a mental health disorder, that's why I did this. It's actually something legal. Right, thank you so much. So there's a lot of stigma with mental illness. I'm not sure if you can give us a reason why, but apart from that, how does it affect the management of people with mental illness, Dr. Cranton?
Okay, so I think some people, it just has to do with some misconception. Some people feel if they come close to somebody who has mental illness, it is transferable. It's a myth. Some believe, so you know how if somebody wants to get married to somebody, they go and then look into the background. If there's somebody who is suspected to be, or there's a family history of, there's the tendency for the family to say, no, that's not going to happen. So there's a lot of stigma. So people, if there's a case like that, they tend to hide. They don't seek help, or they tend to do away with people. And that's why, so those who are walking on the street, they have families. There are people they know, but they wouldn't want to be associated with them. So it is those who care, and that's what we need. The care is not just from our side, because there's family involvement. Dr. Apeku mentioned that that's like social and family support. That is needed also in the management of. So if that is not forthcoming, it becomes problematic. We've had cases where family members just bring people, come and drop them, give wrong numbers, wrong addresses. We've been chasing people who have been with us for the last 15 years, 10 years. We don't know. I'm sure some people have actually had funerals and taken monies. Meanwhile, other people are with us. So it's problematic. It's the stigma. It's all part of it. As for the why it's because people don't want to be associated with shame. But it's just like malaria. You are not ashamed if you have malaria or you are having diarrhea or any other thing. It's just like the way people react when we are in senior high school. Somebody has an epileptic fit and everybody goes away. It's a stigma. But seizure disorder, which we also manage, is a medical condition too. But then it's not somebody on medication. Actually, medication can solve that problem.
Yeah.
It's not transmitted. So people have associated various things in Suba, like somebody, the mom went somewhere for the child, and that's the result of it. And that's the stigma attached to some of these conditions, and it's wrong.
Yeah.
Very, very wrong. And so it affects the way we treat, because we know that if the person is sent home, they are not going to get that attention they need. That support is not going to be there. There are cases where family members, because they don't want the person around, actually withhold the medication. So the person would relapse, and then they'll bring the person back. So all of this affect the management.
Yeah.
Definitely it does.
Yeah. Dr. Apreku, I don't know if you have anything to add to that.
Yes, very good points by Dr. Cranston. And just to add, unfortunately, the stigma when it comes to mental illnesses, it's not just from the society, sometimes from other health workers.
Thank you.
So there have been times when we were we've been trying to integrate mental health into the general healthcare system, for instance. But up to now, for instance, mental health illnesses are not covered on the National Health Insurance scheme.
Okay.
And so if you have a mental illness, you have to pay out of pockets. And sometimes other health workers will discriminate against mentally ill people, right? When they come to the emergency and people notice that there's a patient who is coming to psychiatry, everybody neglects them. Even their vitals don't get checked. People forget that people who have mental illnesses can also have other medical conditions.
Yeah.
And there have been times when a patient with a mental illness comes to the hospital with another condition. And then because they are known to come to psychiatry, nobody sees to them. And so their medical condition gets ignored. So a person who is known to have a psychiatric illness comes to the hypertensive clinic, and then they are directed to go to psychiatry for their medications. But we don't treat hypertension. I mean, fine, we can treat hypertension, but the main reason they came was because of their hypertension, for instance. And so sometimes it becomes difficult. There has been a time when I had to take on a senior colleague because I went to see a patient and he made a comment, some very unpalatable comments about the patient's condition, which shouldn't happen because we should know better and should be educating the public on it. And so sometimes, unfortunately, it comes from health workers too. And then maybe at this point, we can talk about the fact that a lot of people believe that they are spiritual illnesses. And so when you have it, it means spiritually you are weak, or you've committed some crime, or someone has cast a spell on you. But it is no more a spiritual illness than malaria or hypertension or diabetes. I mean, hypertension or diabetes will destroy all your organs before it kills you. But there's no mental illness that is going to destroy your organs and then kill you, right? And so usually from our understanding, our lack of understanding of these conditions, we have some perceived ideas about them and it becomes a problem. That is what also feeds into the stigma.
Yeah, thank you so much. I have a question. So the person wants to know, for a patient who hasn't been on their medications for years, I'm not sure what condition it is there any form of help available to them?
The person hasn't been on medications for years.
Yeah.
Is the person fine? Is the person functional?
Okay.
Is the person able to go about their duties normally? It depends on the condition because who actually took the patient off medication and why? There are things we need to know why. The whole scenario may not be complete without these questions being answered. That notwithstanding, I would want to also add that you do not have to stop your medication, whichever one. This one cuts across every condition. You do not have to stop your condition without the advice of a prescriber or your prescriber.
Yeah.
So there are things we would have to measure or assess. And even for mental health conditions, we don't take people off like we are taking a drug off, like let them stop abruptly. We taper over time.
Yeah.
And even that one we allow you to go home with something small. Because I'm yet to come. Where if you stop, then there's a problem, or somebody actually told you to. If a person lacks insight into the condition, they would not take their medication.
Yeah.
And therefore, that's why, again, the family support is needed for the management of the person, because what we do at any mental health facility is the medication plus or minus the psychotherapy. So if the person is taking the medication, or we give the person at those various intervals and the person is fine, the person can continue being fine at home if you do what we are doing at home.
Okay.
So for the person to go off, there are questions to be asked around. Yeah.
Okay, yeah. So the person just clarified that the person has stopped taking, I'm not sure of the condition still, but the person has stopped the medications and is not functioning normally. Is it okay to chain them up at home? No,
it's not okay to chain people up. I personally have had to tell people who bring their relative tied up, because usually they come in with cellulitis of the hand, because they do it tightly too, or their legs, they get swollen up. So that's another thing we are bringing. So we tell them as much as some can be very, very violent, we tell them immediately they come to untie. It's not right in any form to chain people to a tree or to a bed, or bring the person back to us, and then we'll do what we do.
Okay, thank you so much. Dr. Apreku, any addition to that? If not, we'll take your final words. Why not go so fast when things are interesting?
Yes, so just to add that there is a lot of misconception about violence in mental health. And usually the violence that you notice in people who have mental illnesses is rather towards the people with the illness, not by the people on other people. Okay. And then even where it is from the patients to other people, it's usually in reaction to what has been done to them. And then culturally, I find that usually when things start, we do not like to try to sort them until they become a real big pressing issue. Yeah. So you'll find that, for instance, someone may wake up in the morning, they start talking, they are singing, going about the house. Everybody has noticed that something is not right, but everyone leaves him, goes to work, they come, the person is still talking. They talk throughout the night. And then in the morning, they become very hyperactive. Now they are threatening people. And then still, they just keep only talking to the person until something very drastic happens. That is when they now decide that, okay, and then let's change them. But if they had acted earlier, they may just have been able to just tell the person, sit in a car, let's go to the hospital, and the person would have followed. And so if we are very proactive in approaching these issues, then it will go a long way in preventing us from chaining our own relatives.
Yeah, very true. Thank you so much. So any final words from both of you?
Okay, thank you. I want to let our viewers know that there is help available. Do not internalize it. Find somebody to talk to. Whenever you see something off with you, something that's bothering your mind, get somebody to talk to. Yeah. It's not shameful to walk into a psychiatric. It's not shameful to walk into Ankafo or to Kolebu or to Pantine. It's never shameful, because you need your mind to function so that you can do anything productive. So there's help available. There are a lot of people around. There are community psychiatric nurses who would also direct you to us if they feel that what we are coming in with is beyond them. There's help available. Let us take let us be proactive about our mental health this year, and in fact forever, so that we can continue enjoying life.
Yeah, thank you so much, Dr. Cranton. Dr. Apreku, any final words?
Well, first of all, thank you to Hope TV for doing this very good work. And what I would like to tell viewers is this. Everyone has health, and everyone has, so we have physical health, we have mental health, everyone has it. And the same way that everyone can become sick physically is the same way that everyone can have a mental illness. Having a mental illness is not the end of the world. It doesn't mean that you are not going to function anymore. It can happen to anyone. We have doctors, we have nurses, we have lawyers, we have bankers that we treat. Even big people, politicians, anyone can have a mental illness. It does not mean that everything is over. These people are still working. And if you see them, they are big people when you respect them, because you do not know that that is what they have. And so let us take that out of our minds, that the only mental illness someone can have is them walking on the streets. No, it's very, like, a very minute portion of people with mental illnesses that end up on the streets. And even those people, it's because they do not have any help. A lot of them, if they got help, they would do well, they'll be able to go back into society and be productive members of society. So let us all take our mental health serious.
There's help available, so please seek help. Don't sit home and diagnose yourself. Try and see a specialist who has been trained to diagnose you and help you. So please do well to seek help. And remember, your mental health is very important. Thank you so much for joining us tonight, and have a good night.